So I want to circle back around to the
Yeah,
anesthesia when it comes to that. I had general anesthesia for my surgery. I didn't have any issues with it, but people will say, you know, I see in groups that it's hard on the body, that you should do twilight or local. What are your thoughts on this?
sure. Uh, with a minor procedure like a blepharoplasty or something like that, I will use IV sedation, twilight sleep. Now, when you get, and first of all, it doesn't matter anymore with the anesthetic agents that we have if a patient is asleep for 30 minutes or 3 hours. The anesthetic agents are so good that that's not a factor anymore, the length of the anesthetic. Um, Also, for a longer procedure, you're counting on a little, if you're going to try to do it with a twilight sleep or sedation, when it goes for a long time, your patient's going to get very uncomfortable on that table. And they're going to want to start to move to one side or the other. They're going to, I mean, you're talking about sometimes 3, 4, 5 hours. And it's just really hard to, to be in that position for that long. Also, with the sedation, you're usually using drugs that are going to build up with time. You have to use a lot of propofol to keep them, like drowsy and asleep. And two, the airway. I mean, the longer it goes, I mean, when someone is sedated, you have to maintain and hold that chin up to keep that airway open because there's no breathing tube in. So for a longer procedure, it's not only more comfortable for the patient, it also helps cut down the bleeding because when a patient gets uncomfortable and they're moving and they kind of know what's going on, that blood pressure is going to rise. The blood pressure stays down with a general anesthetic. And also something else that the airway is secure. You don't have to worry about the airway. You got an endotracheal tube in, that patient's airway is secure. You don't have to worry about that. So for a longer procedure, I think I would be anti IV sedation, twilight sleep for a longer procedure. I think hypertension, bleeding, uh, just the patient being uncomfortable, having to add more local anesthetic and more because you're dependent on your local anesthetic at that point. And airway management, to me, a longer procedure, more comfortable, less complications, and safer. And one thing that people don't understand about anesthetic agents is that you have to say you're having a general anesthetic. They put you to sleep with some propofol, and then they put the breathing tube in, and then they put you on a gaseous agent. You have to keep a person asleep. The tendency is they're metabolizing these drugs. They want to wake up, so you have to work to keep them asleep. And you cut the agent off, and they're going to wake up. It's just the opposite. The the anesthesiologist doesn't have to wake you up. They have to just quit keeping you asleep and you'll wake up,
Gotcha.
So that's not a concern.